NCLEX RN Exam Practice Test 2026 questions to prepare like the real exam. Question 1. A patient presents with an asthma exacerbation and reduced peak flow. Which medication class should the nurse anticipate administering first? Option A, beta-adrenergic blockers. Option B, bronchodilators. Option C, inhaled steroids. Option D, oral steroids. The correct answer is option B, bronchodilators. Short-acting bronchodilators, like albuterol, are the first-line treatment to open the airways during an acute attack. Question 2. A patient presents with a persistent cough with thick sputum, lower extremity swelling, and blue-tinged nail beds with a 40-year smoking history. What is the most likely diagnosis? Option A, adult respiratory distress syndrome, ARDS. Option B, asthma. Option C, chronic obstructive bronchitis. Option D, emphysema. The correct answer is option C, chronic obstructive bronchitis. Chronic bronchitis is characterized by a productive cough, blue bloaters, and peripheral edema due to right-sided heart strain. Question 3. A postoperative embolectomy patient is refusing further surgery despite missing pulses. What is the nurse's initial response? Option A, to explain the risks of not having the surgery. Option B, notify the physician immediately. Option C, notify the nursing supervisor. Option D, record the client's refusal in the notes. The correct answer is option B, notify the physician immediately. The surgeon must be notified immediately of the change in vascular status and the patient's refusal, as this is a limb-threatening emergency. Question 4. During the endorsement, which of the following clients should the on-duty nurse assess first? Option A, 58-year-old with heart failure, BP 126/76. Option B, 89-year-old with end-stage heart failure, DNR. Option C, 62-year-old with thrombophlebitis receiving heparin. Option D, a 75-year-old with new-onset atrial fibrillation receiving diltiazem. The correct answer is option D, 75-year-old with new-onset atrial fibrillation receiving diltiazem. New-onset atrial fibrillation requires immediate assessment of hemodynamic stability and the response to the IV diltiazem. Question 5. A patient taking phenytoin, Dilantin, for seizures presents for a follow-up. What is a common oral assessment finding for this medication? Option A. The gums appear enlarged and inflamed. Option B. The white blood cell count is low. Option C. Occasional missed doses. Option D. Patient wants to renew driver's license. The correct answer is option A. The gums appear enlarged and inflamed. Gingival hyperplasia, enlarged/inflamed gums, is a well-known side effect of long-term phenytoin use. Question 6. A child with Hirschsprung's disease presents with fever, explosive diarrhea, and abdominal distension. What is the priority action? Option A, monitor the child every 30 minutes. Option B, notify the physician immediately. Option C, administer an antidiarrheal. Option D, administer antipyretics for fever. The correct answer is option B, notify the physician immediately. These are signs of Hirschsprung-associated enterocolitis, HAEC, a life-threatening complication that requires immediate medical intervention. Question 7. Which method is most appropriate for measuring the urine output of a 2-year-old toddler who is not toilet trained? Option A, weighing the diaper. Option B, insert Foley catheter. Option C, ask the mother for number of changes. Option D, compare intake with output. The correct answer is option A, weighing the diaper. Weighing dry versus wet diapers, 1G equals 1 ml, is the standard non-invasive method for accurate output measurement in non-toilet trained children. Question 8. When planning care for an 8-year-old boy with Down syndrome, the nurse should: Option A, plan according to the levels of a 5-year-old. Option B, a plan according to the level of a 7-year-old. Option C, direct all teaching to the parents. Option D, assess the child's current developmental level and plan care accordingly. The correct answer is option D, assess the child's current developmental level and plan care accordingly. Children with Down syndrome have varying degrees of delay. Care must be individualized based on the specific child's current functional and developmental level.